Hi everyone, welcome to the Home Care Dental Products presentation for our dentistry unit in Prahran Veterinary Hospital. I wanted to talk today about home care products and what we can do to make home care more effective, and what are the best products to use, when to think about using different products, and what are the pros and cons of each of the products available. There's a confusing array of home care products out there and on our shelf even. We'll go through a few of them today and talk about each one individually. The first thing to think about with home care is that there is two different areas that we work on with cleaning. The first one is mechanical cleaning, and that does about 80% of the work. The rest is done by chemical cleaning, which helps to reduce bacterial load in the mouth. So we'll talk a little bit about mechanical cleaning first. The whole premise behind mechanical cleaning is that we're removing the plaque film that develops on the teeth, and that can develop within half an hour of eating, and also fairly soon after we clean the teeth. They're starting to get this soft plaque film in place. If you leave that film in place for more than 3 days without disturbing it, it will start to accumulate calcium from the saliva and turn into a calculus. So it's really important to try and get that off. Some of the things we need to think about when we're recommending mechanical cleaning methods to our patients is whether they will do it or not. So some patients have a temperamental deficiency, which means that it's impossible for their owners to brush their teeth. The other patients are missing teeth or have malocclusions, like this little guy in our photo, which means that their mouth is painful, and we may need to correct that first. Some dogs don't like chewing, they do prefer soft food, and or on the opposite end of the scale, they may inhale or chew their chews up too quickly so that they don't actually touch the teeth for long enough to get a mechanical cleaning effect. Some animals will chew incredibly vigorously and damage their teeth on inappropriate things, and that can include super hard objects. Deer antlers are my new number one hit thing. I don't like them. They are causing a lot of problems and cracking a lot of teeth out there, but they are sold extensively in pet shops. So the chews need to be used every day to have maximum effect. Just as I said, if you don't remove that plaque film or disturb it within 3 days, it's already calculus, and calculus is much harder to remove than plaque. Changing the chews up a little bit so that we get different shapes in the mouth might help to get into different areas of the mouth, and be more effective in that way. TD is, I think everyone's fairly familiar with TD. The way that I describe it to clients is that it acts like dental floss while we're chewing on it. So you can see our little mnemonic down the bottom here. The tooth penetrates into it. It's actually softer than some dry food, so it doesn't shatter straight away. The tooth penetrates in, and then as it pulls out, it rubs the bacteria and plaque away from the tooth itself. Reducing the bacterial load and reducing the plaque load in the mouth can be a really great way of controlling dental disease, because that's where most of the problem starts. So the thing to remember about TD is that we need to get the biggest bit possible into the animal's mouth. So if you have a small Chihuahua who really loves to eat the large bites, that's fantastic. He might only eat 3 bites a day, but that's still his entire food ration. But the bigger the piece, the better. You may find that there are bigger dogs that aren't chewing it as well, so you might want to start with the small bites and gradually introduce a few of the bigger ones once they're into chewing a little bit more, and move over to the big ones over time. So particularly with dogs. With cats there's only one size. Another thing to remember about TD is that it is incredibly tasty, so some animals will overeat it, particularly cats, and it can lead to obesity, so just remembering that. The other side of home cleaning is your chemical cleaners. So there's lots of things out there in pet stores that will reduce plaque or make breath better. And remembering that this only does about 20% of the job. So it can help in achieving a clean mouth, but it's not the only thing we should be doing. As a little aside, it's an interesting thing to go into the pet shops and see what's there and actually pretend you don't know anything, and hear what pet stores are telling people about dental products that are available in their clinic, in their practice, or in the pet store. It's really, really interesting exercise to do. Going back to mechanical cleaning again, I think everybody's aware that we do have some new home care chews that will be coming out in October. These are called Orovets chews. The little central white bit on the chew here, you can see it coming through here, is impregnated with a chemical. So it does the 80% mechanical cleaning, but it also does have a chemical in it that helps to soften the plaque and soften the calculus to help to remove it. Of the tests and trials that we've done so far, it seems to be incredibly well tolerated. It does have a small amount of beef protein in it, so it can be a problem with our dietary restricted dogs. And you need to be careful that you choose the appropriate size for your patient. Sprays and rinses. So we've got Hexarinse here. Hexarinse is a chlorhexidine solution that has an orange flavour in it to make it taste better and more palatable, because chlorhexidine is a remarkably unpalatable product. It is used post-extraction with open gums, so you're unable to suture it, or for dogs with cups that need a lot of bacterial load reduction, if we can't brush because they're too sore. Basically all it is just a quick squirt up under the lip twice a day, and then the dog tries to spit it out and it actually moves it around the teeth. Just remembering, maybe squirt one side in the morning and squirt the other side at night, so that you do get a reasonably even coating in the mouth. That can be really, really helpful if you have a patient that really can't go under an anaesthetic but has a small infection. You can actually squirt that directly on the tooth or brush it onto the tooth with a toothbrush as well. Using water additives, Healthy Mouth unfortunately went off the market for a while, but it is coming back. It's used in dogs and cats that have periodontal disease, and it bathes the mouth every time you drink it. It's got oils and compounds that actually slow down bacterial growth, and it actually slows down periodontal disease as well. So it can soften calculus over time, so if you use that in conjunction with brushing, then you've got a fairly all-round mouth cleaning home care product there. So it's better than nothing if you can't brush. Just on the side, there's a fair bit of stuff coming out on the internet about coconut oil and rubbing coconut oil onto dogs' teeth. It's also called oil pulling in humans, and basically where you put coconut oil in your mouth and you swill it around your mouth for about 5 minutes. There is a little evidence out there that says that it can help with periodontal disease in humans, so it's certainly something that we shouldn't diss. But if you use it in large quantities, it can give them diarrhea, and it can be quite messy because it's oily. You shouldn't use it in mouths that have got amalgam fillings or silver fillings, because it can leach the heavy metals out of the silver, and that can cause heavy metal toxicosis. Luckily we don't use that in veterinary dentistry, but it's just something I thought that was interesting that you guys might like to know about. There is one water additive that I actively discourage use of. It's called Aquadent. It's used in dogs that have periodontal disease to bathe the mouth every time they drink, similar to our Healthy Mouth but a little bit different. We don't recommend it because it's got low levels of xylitol in it, and at higher doses it can be quite toxic. So if owners get the dilution wrong, it can be very, very bad. It can cause sudden hypoglycemia or low blood sugar. So I'm a little bit uneasy about recommending it, so we don't have that on our shelf anymore. So just in conclusion, when you're recommending home care products, you need to base them on each individual's needs. You need to consider mouth structure, missing teeth, pain levels when chewing, dietary restrictions, whether they've got allergies, etc., the patient's temperament, the owner's lifestyle and time availability. So if they're working 70 hours a week, they're not going to brush the dog's teeth at home, and it's impossible for us to recommend that and expect it to happen. And also the medical needs of the patient as well. So Most of all, it just needs to be achievable. There's no point recommending something that will not be tolerated or won't be used by the client. So we need to have them on side. So if in doubt, if you've got someone who you think will be compliant but you're not quite sure, remember to put in those reminder calls. The ABC nurses can give owners a call and see how they're going with their dog's teeth. The most home dental care plans, people leave the clinic with the best of intentions, but within 3 weeks they're no longer brushing the teeth. So just remembering that we need to follow up on these as well, and just keep encouraging our clients to brush. Alright, thanks for your attention, and I hope that you learned something today, and feel free to come and see any of the senior staff or Nicole in particular if you want more information about any of the products that wind up on the shelf. See you later.